Privacy and Security Brainiacs is pleased to provide you with our HIPAA enforcement summary for the second quarter of 2021. Since April 2003 through June 30th, 2021, the total number of HIPAA civil money penalty cases is 101. The total of all HIPAA penalties applied is $135,328,482. Fines and penalties applied in the second quarter of 2021. 2 HIPAA non-compliance enforcement actions consisting of fines and corrective action plans, which I'll call CAPs for short, were applied in the second quarter of 2021. One was for HIPAA non-compliance discovered by complaints from an individual for the HIPAA right of access requirement, bringing the total penalties applied to this specific type of violation to 19 as of the end of June 30th, 2021. One penalty was to settle the HIPAA security rule non-compliance violations. Both entities are covered entities. In addition to the monetary penalties, each entity was required to implement comprehensive caps that include up to 3 years of monitoring by the U.S. Department of Health and Human Services, or HHS for short, Office of Civil Rights, OCR for short. The second quarter 2021 fines for both entities totaled $30,000. Next, I will provide summaries and high-level details about each of the 2 entities against whom penalties were applied by the HHS during the second quarter of 2021. Peach State Health Management LLC, doing business as Aon Clinical Laboratories. We'll call them Peach State, and they are a covered entity. They're located in Georgia. The penalty against Peach State is $25,000 plus 3 years of OCR monitoring of the Peach State cap. Here is a summary of information about the Peach State HIPAA violation. An OCR investigation and compliance review of Peach State was initiated in December 2017 to determine its compliance with the HIPAA privacy and security rules. That review found systemic non-compliance with the HIPAA security rule, including failures to conduct an enterprise-wide risk assessment, failures to implement risk management and audit controls, and failures to maintain documentation of HIPAA security rule policies and procedures. Peach State agreed to a cap, and it includes what you will see following. It's pretty detailed, but we will provide you too a link to the actual detailed corrective action plan at the end of our overview. Peach State must conduct a comprehensive enterprise-wide risk analysis, sometimes called a risk assessment instead, of the security threats and vulnerabilities of all PHI created, received, maintained, or transmitted by Peach State, including all electronic media, all workstations and information systems owned, controlled, or leased by Peach State, which store or access electronic PHI. And think about the fact that these include devices, computing devices also, used by the workers, even if those workers own those devices. The risk assessment must be sent to HHS. The HHS will review the risk assessment and they will either approve of it or they will require additional assessment and revisions. Peach State must develop a comprehensive risk management plan to address and mitigate any security threats and vulnerabilities that were identified in the risk assessment. Peach State must develop, maintain, and revise as necessary its written policies and procedures to comply with the HIPAA privacy and security requirements, and the policies and procedures must address the threats and vulnerabilities to PHI that were identified in the risk assessment and the risk management plan. Peach State must distribute the updated and new security and privacy policies and procedures to all members of their workforce within 30 days of the HHS's approval of those policies and procedures. Then, each workforce member must sign a certification indicating they've read, understand, and will comply with those policies and procedures. Peach State also cannot allow any member of their workforce to access PHI if the workforce member did not sign a certification indicating that they did indeed read, understand, and agree to follow the policies and procedures. Peach State must report to HHS when workforce members did not comply with the security and privacy policies and procedures and provide related details. Peach State must provide HHS with all the privacy and security training materials that they require their workforce member to take. Peach State must update their training as directed by HHS after the HHS finishes their review of the materials. Each workforce member taking training must certify that they had the training, and they must provide the date of the training and indicate and certify that they understood the training. Peach State must designate an independent individual or entity to be a monitor, and this monitor must not only monitor but also review Peach State's compliance with the CAP. The monitor must certify in writing that it does indeed have expertise in compliance with the HIPAA security rule and that the monitor is able to perform the reviews described in a professionally independent fashion, taking into account any other business relationships or engagements that may exist. Many other requirements were also made for the monitor within the formal CAP. Within 60 calendar days after the receipt of the HHS's approval of their updated or new policies and procedures, Peach State must submit a written report to the HHS summarizing the status of their implementation of the requirements of this CAP, including an attestation from the owner or an officer of Peach State and a copy of the engagement letter with the independent monitor, along with certification of independence and the qualifications of the monitor that has been contracted. For 3 years following the effective date of the agreement, on the agreement month and day, Peach State must submit a report to HHS and to the independent monitor that details their compliance with the cap for that full year, including an attestation signed by an owner or an officer of Peach State, attesting that all members of the workforce have completed the right to access training and that they comply with the policies and procedures. You can read the full resolution agreement and cap at the website address shown on your screen. Diabetes Endocrinology and Lipidology Center, called DELC for short. DELC is a covered entity located in Martinsburg, West Virginia. Penalty amount is $5,000 plus 2 years of OCR monitoring of the DELC cap. Here is summary information about the DELC HIPAA violation. On August 6, 2019, OCR received a complaint alleging DELC is not in compliance with the privacy rule. The complaint alleged DELC refused to provide the complainant with access to her son's protected health information, or PHI. On October 30th, 2019, OCR notified DELC of its investigation of DELC's non-compliance with the HIPAA privacy rule right of access to PHI requirements. DELC ultimately agreed to a cap that includes the following. DELC will review and revise their individual access to PHI policies and procedures within 30 days from the effective date of the agreement. DELC will provide training to their personnel that covers individual access to protected health information, and they will provide this training within 60 days from the effective date of the agreement. DELC will provide the complainant with access to the requested patient records within 15 days from the effective date of the agreement. DELC will regularly report to the HHS within 90 days each request they receive for access to patient records, including the date the request was received, the date the request was completed, the format of the information that was requested, the format that the PHI was provided, the number of pages if it's in paper format, the cost, which would exclude postage. DELC will immediately investigate worker non-compliance with right of access policies and procedures and will notify HHS in writing about such non-compliance events within 30 days of the non-compliance events. Within 120 calendar days after the receipt of HHS's approval of their updated or new policies and procedures, DELC must submit a written report to HHS summarizing the status of their implementation of the requirements of this cap, including an attestation from the owner or an officer of DELC. For 2 years following the effective date of the agreement, on the agreement month and day, DELC must submit a report to HHS detailing their compliance with the cap for that full year, including an attestation signed by an owner or officer of DELC attesting that all members of the DELC workforce have indeed completed the right to access training and that they comply with the policies and procedures. The DELC penalty is the 19th penalty the HHS has applied for violating the right of access requirements under the HIPAA privacy rule. You can read the full DELC resolution agreement and cap at the URL shown on your screen. We hope you found this summary of the second quarter 2021 HIPAA enforcement actions useful. Privacy and Security Brainiacs also provides a free ebook with a brief summary about the Q2 2021 HIPAA enforcement actions at the URL shown on your screen. For more in-depth training, Privacy and Security Brainiacs asks you to consider our premium HIPAA training modules and other information security, privacy, and compliance training modules. Our training topics include training modules that cover all the requirements that were just described as being required by the HHS in those caps. We provide a free business admin account with a learner management portal and a variety of reports and capabilities for the business admin to manage all their workers and learners. For our paid premium training modules, we also include an associated quiz, a certificate for each person taking the training, and also expanded capabilities for the business admin to manage their learners, along with additional summary and expanded reports. The larger the number of learner seats purchased at one time for a class, the lower the price for each learner seat for that class. There are no subscription fees for our classes. Please see our website, www.privacysecuritybrainiacs.com, or get in touch with us using info@privacysecuritybrainiacs.com for more information. Also, check out our growing number of free and premium paid training modules covering a very wide range of topics. If you don't see a topic that you need, get in touch with us about those too. We will be happy to consider adding additional training for topics that we don't have listed. Thank you for watching today.